Sorry, it's been a minute. Let's learn about PAD and PVD. You're going to notice PAD and PVD are similar in treatment, but different with symptoms. You're going to see it with people with uncontrolled diabetes, hyperlipidemia, hypertension, high blood pressure, people who smoke because why? Smoking constricts. PAD, I want you to think of absent. Symptoms, think of tar. In this case, we're going to use TARS. Toes and feet. If we have no blood flowing to our toes and feet, what do you think is going to happen? They're going to be black. We might see necrosis. You might see what? Absent, weak pulses, because why? We have no blood circulation. Round red sores. I want you to think of blood pooling. Sharp calf pain with exercise or elevation. Why? Because when we have less oxygen, we have more pain. For treatment, think of arteries hang. So we're going to dangle our legs to help circulation. We might use antiplatelets. We might give statins to help lower cholesterol. And we might see them get an arthrectomy or a CABG, which is going to help remove plaque and improve blood flow. What you can teach your patient is to avoid crossing their legs. Why? Because that is not helping circulation at all. And we also need to teach them to keep their legs warm to keep that circulation in their extremities. For PVD, think of volume. So think of veiny. So we might see what? Very big pulses. We might see swelling, irregularly shaped sores. We're not going to have any sharp pain. Why? Because we have circulation going on. We might see thick, tough, yellow-brown skin. For treatment, I want you to think of veins need to elevate. So we need to what? Elevate our veins. We need to use antiplatelets, statins to lower cholesterol, and we might see a stent placement. You might want to teach your patient to avoid sitting or standing for a long amount of time. And you also might want to recommend avoiding caffeine because that constricts.